Good afternoon, everyone. Thank you for being here. I am joined this afternoon by Dr. Joseph Cantor, who's with the Louisiana Department of Health, as well as our coroner, Dr. Jerry Satanovich, our Emergency Management Operations Director, Joe Valiente, as well as our Property Maintenance and Zoning Director, Catherine Topple. So currently, in Jefferson Parish, we're at 11,256 cases, unfortunately with 495 deaths. I'll go over the last week cases. If you look at the week from July 5th through July 11th, Jefferson Parish has seen 1,121 cases for that week. The following 2 days was 105 cases. Today we had to endure another 156 cases. So with that week, that's the first time in Jefferson Parish we've had a week over 1,000 cases since we were really fighting this first fight, I call, at the end of March and April, where we had, during our roughest times, we had over 2,200 cases in 1 week, and the following week, 1,800 cases. So since that time, and I've said it before, April 20th to about June 20th, we've been able to plateau at a low level. Starting at around June 20th, we've been on the uptick, and this last week is our first week with over 1,100 cases. So we are in the midst of this still very much. I'll push to testing, and I want to clarify something that I keep hearing in this community. We're very proud in Jefferson Parish to have been very aggressive on testing since the beginning. We were one of the first federal testing sites, two in Orleans Parish and one in Jefferson Parish, and we've stood up that site ever since that day. That site is operational today. So today in Jefferson Parish, we surpassed the 100,000 testing mark. 100,860 tests have been done in Jefferson Parish, by far leading the state. We also lead the state in cases as well. I want to thank, especially now that we've reached the 100,000 mark, so much of our team that's been involved in the community testing at Ilario Center site, which contributes to that number significantly. Our Emergency Management Director, our General Services, Recreation, all of our Ilario Center employees, our West Bank volunteer firefighters, the Jefferson Parish Sheriff's Office, of course the Louisiana National Guard, DOTD, as well as our community partners in this, and they have been wonderful at helping us set up mobile testing sites, community testing sites where it's needed most, Oshner. All of these testing that we have been involved with, that we've partnered with, it's been almost nearly 20 sites that we've been involved with have been free testing. So you have this people believing that we've been very aggressive on testing in Jefferson Parish, and that's the reason why our numbers are high. Certainly, and I think you could say that in prior weeks, the more you test, the higher your numbers are going to be, because you're just revealing what's already there. And I've always been very much a believer, you have to reveal what's there. That's your first fight. But again, as I said last week, as I say today, something additional is going on in Jefferson Parish, because we see it on two fronts. We see it at our testing sites, where a couple of weeks ago we were having to send text messages to people. We'd set up a site, we would mobilize, we'd have 250 capacity a day, and nobody was coming. And we would have to send texts to neighborhoods saying, free testing, come get your free test. That stopped as of about 2 weeks ago. Our capacity has been reached at an earlier time frame at Ilario Center. Many of our community sites, the capacity has been reached before we open the door. Many sites last week, we opened it at 4 o'clock. They already had over 150 people in line before we even opened the door. And we see this up until today. So this is something different going on, as I've said, in the past week and a half. Also, the testing, and this is very critical when you look at the data, the testing rate that's coming back positive is much higher. So even though we were aggressively testing, going back to that April 20th to June 20th, testing rates were coming back 3 to 5% positive. We're coming back now at 20% positive. So I want to make sure people understand, the people who are saying, well, Jefferson's just high because it's high testing. No, 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 we are still very aggressive in testing. There is more virus in our community, and that's seen by the people waiting in line who are not feeling well or have been told they were exposed, as well as the percent positive that we're seeing coming back. 20% positive now we're seeing at these testing sites. So I want to make sure people understand that. Right now, we have just gone live with a new Jefferson Parish COVID dashboard. So this is Jefferson Parish specific numbers. It's covid.jeffparish.net, covid.jeffparish.net. This is a local dashboard, includes data pulled from the Louisiana Department of Health. We do not get this data directly. We're not in that loop. Positive cases never come to us first, so we get all of our data through the Louisiana Department of Health. And it'll show the total number and daily increase of cases and deaths, the total amount of tests done in Jefferson Parish, hospital bed capacity, ICU capacity, and ventilator capacity, as well as, this is really critical because we get the question, where is the hot areas in Jefferson Parish? And I've been reluctant to say that because if you think another neighborhood is hot, you kind of ease up your guard where you are. We've all got to be vigilant all the time, but there's a heat map with a breakdown of positive cases by census tract. So individuals can zoom in on the map, maybe their neighborhood specific, maybe where they work, their school is, and see where the hot spots are. You can right-click over that geographic area, over that census tract, and you can see the total number of cases by that area. So it's good information, again, Jefferson Parish specific information. We've gotten a lot of inquiries, especially from the media, on our COVID compliance hotline. We call the See It, Say It hotline. First of all, I want to say since July 1st, and now we're also under my own emergency proclamation that went into effect July 1st, as well as the governor's statewide mask order, mandatory mask order. I want to thank everyone for the overwhelming compliance that I have seen in Jefferson Parish with wearing masks. I think the business community has really come together. I think we as customers have come together. And what I always say is to fight that common enemy. Let's come together as a community and fight this common enemy, learn how to live with this virus in our community, learn how to manage this daily new case count so we can keep living with coronavirus here with us. I think the response has been incredible. I think the response has been tremendous, and I want to applaud everyone because overwhelmingly when I go out, people are following, putting on their masks when they're indoors, and I want to thank people for that. And I know businesses had a very short window of time to do that. They were very creative. They put signage out in the front door. They've have people stationed. They've been overwhelmingly responsive. So I want to thank people for that. I also want to thank people who see something that they think does not meet with the requirements of what our community is demanding now and calling in. So since our launch of the compliance hotline, the See It, Say It hotline, we've had 2,599 complaints. I want to thank we're enforcing this with our own administration, so I have Property Maintenance and Zoning Director Catherine Topple here. She has taken about, at any given time, 10 quality of life inspectors to deal with the enforcement of that. So as of today, we looked at the number of complaints we've had, the multiple complaints we've had for those businesses. And since this time, we visited over 50 businesses. Again, we want to not trip up businesses. We want to get people to comply. Give them the best practices to facilitate compliance. That's really the goal of this thing. We really don't want to be in the enforcement game, but I know as a public policy perspective, if you're going to have a rule, you have to have an enforcement there, and we have to have the enforcement there. But I would say overwhelmingly, it's been a great success. Catherine's staff has visited 50 businesses. If we still get complaints after that first visit, she has also visited a second time 4 more businesses. We will probably do follow-up checks, and if we get more complaints on that, I think you've been warned well enough. If you've had 2 visits from Jefferson Parish asking you to comply, you'll see some misdemeanor summons coming around there. But again, our goal is to get compliance. Our goal is to get businesses to believe in this, to want to take care of their customers, to want to take care of their employees. And I would say in Jefferson Parish, we're doing a phenomenal job from that. But having said that, we have visited 50 businesses. We've done a second visit to 4 businesses. And we hope for compliance with all those businesses. But again, if we don't see it and we know they're educated and we know they understand the rules, both from a parish perspective now as well as a state perspective, we're going to use our enforcement tools that we have. Again, the number is 504-736-6929 is our COVID compliance hotline, our See It, Say It hotline. You can also go to www.jeffparish.gov to get an online form. I also want to say today there's free testing. We have moved, and I want to thank Oshner for being creative with us, and anything we ask to get testing more into the community in better ways. We switched the latest community testing to 4 p.m. Start, so people can get testing after work. That was something that we heard asked for. So Celebration Church in Kenner on Williams Boulevard, we're doing testing today and tomorrow. I would suggest if you're trying to get there, arrive early. The line does form, as I've said, starting at 4 p.m. And then we have an opportunity at Ilaria. We've held up that site since March. For this week only, and I hope it can continue, but we have a unique opportunity at Ilario Center to sort of piggyback on some other testing being done. So our results for Ilario, test results, have not been the way we wanted it, and that's not something we control. Our tests are sent out of state, and it's been a 10 to even 14-day lag, which is unacceptable. It almost defeats the purpose of testing if you're not finding out until 2 weeks later. So for this week, we have an opportunity to partner with the state and federal government for some new turnaround times. Temporarily, we're going to be able to send our Ilario Center specimens to a different lab. We hope it's a 3 to 5 day turnaround. Again, right now we're told this is only with us and available to us this Saturday. We will certainly make any opportunity we can, and we will do whatever it takes to try to get quicker results. Also, again, until Saturday, because we're kind of have a window of opportunity to piggyback on this other testing site, there is an opportunity to kind of sign up ahead of time, and you know, those of you who've been to Disney World understand the Fast Pass concept. Sign up ahead of time and kind of have a reservation in place, and you can drive up to a shorter line. So that website is doineedacovid19test.com. doineedacovid19test.com to pre-register, and if you're able to pre-register for Ilario, you're able to kind of go in a Fast Pass lane. Again, right now, this is only until Saturday, but we're able to have this opportunity. So from now until Saturday, we're going to open Ilario from 7 a.m. to 7 p.m. to get as many tests as possible under this temporary testing system we have. Again, we will always be aggressive on testing. We will take, I told this to my team months ago, take any opportunity available to us as a parish and jump on it. I know it's a little confusing that I'm telling you this for just a couple days. We hope it will continue. But because the results are so different for us and so much quicker, we're going to go ahead and do that. Again, I've been mentioning upcoming blood drives with the Blood Center. Free antibody test for anybody who wants to donate blood. So that's a great benefit. Saturday, July 18th from 9 to 1 at Pard Playground in Marrero. Saturday, July 25th from 9 to 2 at Pontiff Playground in Metairie. So you can give blood and also get your free antibody test. And you can visit thebloodcenter.org to sign up in advance. I'm going to also use this time to remind everyone, as I always do, please fill out your census form in Jefferson Parish. Our response rate is still just 62.2%, and I want us to do better than that. It's critical that everybody in Jefferson Parish who lives here, that we get counted for you living here. This is how we get our resources. This is how you get your representation at the federal, state, and local level. This is how big companies decide if they're going to build a headquarters in our area. Anything that's decided on population estimates, this is where the data comes from. So it's very critical that everybody please take the time to fill out your census. It's 2020census.gov, 2020census.gov. Again, very easy, by mail, by phone, by internet to do the census this year. Again, our website's www.jeffparish.net. I think I said jeffparish.gov before. I'm sorry, it's jeffparish.net. We have the new COVID page, the new COVID dashboard that we've done. We're on all of our social media channels, Facebook, Instagram, and Twitter. And we want to also remind everyone we have Spanish-speaking JP Noticias at 888-777 for important alerts in Spanish. So with that, I want to invite Dr. Cantor up to give the latest information on specific what he sees in Region 1 and more particularly in Jefferson Parish. So Dr. Cantor with the Louisiana Department of Health.
Good afternoon. Thank you, Madam President. Thanks for the leadership you've shown through these times. Thanks, everyone, for coming out. before we get started, it is really hot this week, so for folks that are outside, of course, from a COVID perspective, it's a lot safer to be outdoors, but I love the umbrella. Please keep water with you. Stay safe when you're outdoors. It's really hot outside. As the governor mentioned on Saturday's press conference, we're in a really tough time right now in Louisiana, and we have an opportunity to turn this around from a state's perspective before we get into a all-out crisis. And that's what we intend to do, and that's the reason why the governor issued a statewide masking order for parishes that have a high incidence, of which Jefferson Parish is one. Closure of bars, unfortunately, and restriction of gathering sizes to 50 people. We're in one aspect, we're a little bit fortunate here because we've been through this once before. We've been through this 2 or 3 months ago. We know what COVID can do. We know how scary it can be. And more importantly, we know how to beat it. We've already beaten it once before in Jefferson Parish. And I know we can do it again. And I hope that we can show the rest of the state how to beat it. To be very clear right now, although we have seen increases in hospitalizations for COVID in this region and in Jefferson Parish, while that signifies to us that the outbreak is growing well beyond what we would see just from doing more tests, we are not yet threatening hospital capacity in this region. Now, other parts of the state, namely the Lake Charles area, the Lafayette area, and the Alexandria area, are getting closer and closer to their hospital capacity, but we still enjoy good capacity here. And I actually wanted to read off the latest numbers to illustrate that point. We have 573 ICU beds in Region 1, of which 223 are open right now. We have almost 3,000 hospital beds all told in Region 1, of which just over 1,000 are open right now. And we have about 650 ventilators in Region 1, of which almost 500 are open and available for use right now. And we still have the medical monitoring station at the convention center in downtown New Orleans that's open and a resource. So I'm confident that we have good hospital capacity right now to care for people of Jefferson Parish, whether it's for COVID or anything else. But we need to be really careful that we preserve that, and the way that we preserve that is to do everything we can to stop the spread right now. Madam President mentioned the tests. The turnaround times that we've been seeing from some of these out-of-state commercial labs, as she mentioned, is just unacceptable. And we have a federal delegation in town right now. FEMA's in town today. Vice President Pence and Dr. Deborah Bricks will be in town tomorrow. And the issue of the testing supply reagents and the national supply chain constraints that are causing these turnaround times to be prolonged is high on the agenda, so it will be addressed. And also this week, as Madam President mentioned, we have an opportunity to send those tests to a different lab and get a quicker turnaround time. So we want to promote that. We want people to take advantage of that. I did want to mention, though, and kind of clear up what a test can tell someone and what it really can't tell someone. And I think this is going to be more important as schools look to potentially reopen, and we're going to have more people with potential exposures, and they're going to want to know what they do for themselves and for their family. The misconception out there is that if you're exposed to COVID, if someone you know is positive and you're with them, that you can go get a test in a few days, and if it's negative, you're good to go. Unfortunately, as much as I wish that were the case, I really do, the science is not there. That's not the case. And the reason that's not the case is because the virus takes time to build up in someone's body to get to the point to make someone sick, but also before that, to get to the point that it's detectable by the test. And I can't tell you how long that is. I can tell you it can range from 2 days to 14 days. I can tell you on average it's around 5 or 6 days. But for an individual person, I can't tell you exactly between that 2 and 14-day period how long it's going to take. So if I were exposed this weekend and I went and got tested tomorrow or Wednesday, could be negative, and I could turn positive the very next day. So getting a test during the middle of one's 14-day quarantine period can give a false negative. It can give a false sense of security. So for someone who was exposed and they're in their 14-day quarantine period, even if they get a test, at a negative test in the middle of that period, they still have to quarantine for the remainder of those 14 days because they could still become positive in the remainder of that time. This is going to be really important summer camps and schools because we're going to have some exposures and it's going to be inconvenient for families to say the least. But I don't want a family to make the wrong choice and put other people at risk unintentionally. So despite having a test, if you were exposed, you still have to quarantine for those 14 days. Beyond that, tests have gone up in Jefferson Parish. Percent positivity of all tests have gone up today. About 10.2% of all tests reported today in Jefferson Parish were positive. That's a high number. There's a lot of COVID out here, a lot of risk in Jefferson Parish. So folks need to know, number one, wearing a mask is the single most effective thing that you can do to prevent the spread. Single most effective thing you can do is to wear a face covering. Second, distance whenever possible. And third, if you don't need to leave the house, don't leave the house. Stay at home if there's any way that you can do that. So thanks everyone and stay safe.
Thank you, Dr. Cantor. Next, we're going to have our coroner, Dr. Jerry Satanovich.
Good afternoon. I'll start off with letting you know that over the last 2 weeks in Jefferson Parish, we've had 5 deaths from coronavirus. Compared to where we were a few months ago, that's still a relatively low number of deaths attributed to the virus. But that said, there's 2 things I want to make sure that everybody understands. Number one is deaths will typically trail a spike by a few weeks. Okay, so I expect deaths to go up, unfortunately, in these upcoming weeks. The other thing is the number of tests. You've already heard everybody say that the number of tests have gone up. We've got way more people positive. But in addition to the increased number of positive cases we have in the parish, we can look at the percentages of who's getting sick. And one of our fears that we've all heard through the media that the last month or so that there's been a huge spike in people under 30 getting the coronavirus. And the logic being, well, those people won't get very sick. But everybody's fear, especially those of us in the healthcare community and me as the coroner, is you just know that those people under 30 are going to go back to their parents and their grandparents and great-grandparents and put them at risk. And unfortunately, I think we're starting to see that come to fruition a little bit because just a week ago, the number of people over 60 who were turning positive was 14.5% of the total positives. This past week, it's up to 19.5% of the total positives. So I do think it's something we need to pay attention to. It's not too late to protect our most vulnerable people, so I encourage everybody to please, be careful with yourselves. Wear your masks. I know it's hot. I think we've disproven the fact that the theory that the heat will kill the virus. So even though it's hot, wear your mask, keep your distance, and most importantly, protect those of us that are most vulnerable. Thank you very much.
Thank you, Dr. Satanovich. Are there any questions that anybody has? Yeah, thank you.
Just to be clear, 50 businesses visited, 4 got a second visit, no citations as of yet?
No misdemeanor summons yet. So Feynman was asking about the enforcement we have with our COVID hotline. Again, 50 businesses were visited, 4 for a second visit, and no misdemeanor summons yet in Jefferson Parish. Any other questions? No? Okay, thank you so much for being here. Thank you.